Thanks for joining our webinar today. We are excited to talk about employer healthcare trends and benefits trends in 2023 and beyond. So our session today is chock full of new information, hot off the press, some statistical information from the end of 2022 on really helping employers not only understanding that their challenges are not unique, that challenges that employers are facing across the country are new challenges, but they're not unique to even one specific industry, and how top performing companies are building strategies around the three following topics that we're going to discuss today. So the first section, we're going to talk a little bit about the shift in employee workforce demands. So we're going to talk about ESG, right? Environment, social governance, how employers are putting in strategies around that. And statistically, the companies that are embracing those strategies have different turnover rates and different ability to recruit and retain talent. We're going to talk a little bit in the second part of our session today, workforce needs in mental health and workforce balance, workplace balance, and remote work, flexibility to work in different environments. So that's going to be section 2. And then section 3 is my favorite topic, healthcare economics. So we're going to talk a little bit about healthcare benefits, the cost trends that we're seeing, emerging cost trends, things that employers need to be aware of, and then some really key strategies on how top performing companies are nailing it with good strategies on that front too. So sit back, enjoy our presentation today. This 55 minutes is worth one continuing education credit for both SHRM and HRCI, and those codes that you need to submit for your credit are at the end of our presentation today. We don't have time for questions because we have a full 55 minutes. But you know where to find me, and my contact information is also at the end of our session presentation today. So thanks for joining us, and let's get started. So let's get started. We're going to talk about the 2023 benefits trends in our very evolving workplace. So thanks for joining us today. So we're going to talk about these three topics. Again, the shift in workforce expectations, mental health and behavioral health needs, and the changes in healthcare economics. We will be providing a copy of all the slides to the participants, so you don't have to try to screenshot or take notes furiously. You'll be provided a copy of the deck. There's a lot of good information in here. We're going to talk about each of these three things and go through a lot of not only the challenges, but provide you with a lot of the strategies that employers are deploying. But certainly employees are placing a higher premium or a higher value on the purpose of work, which organizations are struggling with, right? So it's not just coming from HR, it's really coming from the CEO, how they're moving forward with diversity, equity, and inclusion, workplace life balance, mental health support, flexibility in the workplace, and really balancing all of those with strategies in the healthcare benefits area as well in section 3. So thanks for joining us today. So we're going to talk about environmental, social, and governance impacts, and what is ESG. So it's really, three key dimensional about how corporations are really embracing corporate philosophy really into with their employees into their day-to-day business operations, right? So I know when it comes to ESG for me, I feel very socially connected to my organization because I feel like every single day we do good. We're working hard on behalf of employers, sitting on their side of the table, negotiating with the insurance companies in the insurance market to make sure that they get the best metrics and the best pricing. And to me, that makes benefits more affordable to employees across the country that we work with. So I feel like my social connection and vitality with my company, I have a feel-good vibe every day when I come to work. And employees, especially Gen Zs and the millennials, really, this is not a nice to have, it's a need, it's a necessary. So employers need to really understand their employees and their employee base and what the connection needs to be. Social component of ESG covers companies and how they interact with their employees and communities in which they operate, right? So the external pressures from investors really don't care for this item, but what they don't understand is that it's becoming a war on talent. It's increasingly difficult for us to recruit and retain good talent without this. So if you look at kind of the workforce generation changes over the last 10 years, it's significant, and it's even going to get more significant, as you can see from the diagram. So from 2019 to 2029, the future in the next 8 years, really, if you look at the significant shift in the workforce, this is going to become more and more important to companies. So 14% of the companies with higher ESG scores report higher employee satisfaction and employee retention specifically. So this is an important piece. And investors really, when you come to the board of directors and investors, sometimes we get pushback because they care about the bottom line. They want to make sure their companies are profitable. But we've shown statistically, and you'll see in a minute, that if you have incorporated pieces of ESG within your organization and within your corporate philosophy, you'll get a higher return because you'll have less presenteeism and more engagement with your employee population. Leading employers are taking a great effort versus their peers to understand employee sentiment. We want to understand what satisfies and attracts talents, and really what their social governance and environmental governance centers around, right? We want to understand what our employees are thinking about. So top employers by attractiveness to students and young professionals with these incorporated into their programs statistically are much higher than employees with less social governance. So we're going to talk a little bit about the shifting expectations regarding meaningful support in today's workforce. Talent retention and recruiting is becoming a persistent concern for businesses as they struggle to adapt and adopt policies that reflect what people really want out of work. We really have employees that care less about salary and more about work-life balance, how much time they get off, whether they have to clock in, whether they're independently working, in multifaceted groups, right? So work groups, meaning more diverse work groups reflect a higher outcome when it comes to productivity. So to that end, in organizations that fail to reinvent their approach both to attracting and retaining talent are risking turnover, vacant positions, and lost opportunities, negatively impacting the bottom line. 50% of the workforce are reconsidering their work because of the pandemic, and 3 times more than other generations, millennials are reevaluating work. I have a millennial son, and he actually said to me that he never wants to work as hard as me. And he really values his time off, values his time vacationing and seeing new places. And I think that's a theme with our workforce. And we as employers and people kind of setting the strategies really need to understand that change, especially because the workforce, the population within our workforce is shifting in the next few years. Employers are placing a higher premium on finding the meaning and purpose behind work. 2/3 of US-based employers report COVID-19 caused them to reflect on their purpose in life. So employees are really sitting back and saying, what does work mean? Is it a means to make money to do the things that I want to do and experience in my life? Or is it really a career that I'm after? And there are some shifts in the thought process behind that with employees statistically. People who live their purpose at work and feel like they're more connected at work also are healthier and more resilient and stay at the company longer. So again, this is a strategy and a thought process that really needs to be considered in our strategies if they're not already being considered. So if you look at the top reasons why U.S. employers are leaving their jobs in 2021, low pay, no advancement opportunities are, obviously the highest in 2021. This is shifting steadily. So if you look at some of the other reasons, it's inflexibility, poor benefits, relocation issues. Lots of people experience significant childcare issues. Felt disrespected is right up there as the number third reason for leaving a workforce. So very interesting statistics. I think these are different than what we've had in the past, what we've seen in the past. And today, the need to be action-oriented, understanding these and supporting employees at every level, operationally and day-to-day, to deliver purpose at work are major opportunities for employers. Paying attention to the purpose and opportunity to meet employees where they are, and additional support is easier to provide than employees feel like they have something bigger to rally around when they feel like they have something bigger to rally around. So what are the world's needs? What is the company uniquely good at? What people in the company are passionate about, and what the company can create in economic value are all purpose, right? I explained that I feel purpose every day when I come to work because I feel like I'm fighting on behalf of employees for affordable healthcare benefits. And not just affordable in negotiating, but better clinical programs. Let's face it, our healthcare system in the United States is pretty broken when it comes to navigating through a very complex, complicated process if you have a diagnosis. So my job is to make that easier and create programs that not only reduce costs, but help employees. And that's my purpose. So if you think about identifying in your organization what your company does and creating a purpose around that, it can be very meaningful. This is kind of funny. I put this in here because I think we talked a lot about diversity, equity, and inclusion initiatives in 2020. And then I feel like that fell flat in 21 and 22. And we didn't see a lot of forward movement that we had all of that excitement in 2020. So organizations continue to struggle with moving diversity, equity, and inclusion programs beyond building awareness to create a real sustainable action. So this is actually down 5 percentage points from 2021, yet diversity, equity, and inclusion work remains one of the top most important aspects for improving employee experience across the board. So really an opportunity, I think, to gather ourselves in 2023. We've seen statistics over and over again that talk about a blended workforce team with lots of different people, with lots of different perspectives and paradigms, creating a lot of value for employers. 2 years after companies made a very public commitment in advancing racial equality, we've seen some progress, but definitely not enough. So our corporate leaders are critical in helping us build a society that's equal for each. And this is something that's front burner for a lot of employers to bring this back to the surface in 2023 and reallocate resources. One of the companies that we work with in California incorporated a program in their healthcare benefits with DE&I dollars, which I thought was very creative. So cancer was their #1 cost driver on their healthcare benefits. So what this employer did was they did a survey of their employees, and the older population of employees, 45 and above, said, hey, all of the new benefits that you're rolling out are really geared towards the younger population in the workforce, with fertility benefits, family leave, lots of benefits that are being focused on the younger population. So this company took hold of that thought and said, okay, cancer's the #1 cost driver, and the predominant pocket of people or population of people that it's afflicting the most are the people over 45. So they developed a cancer program. They used diversity, equity, and inclusion dollars for this program. Step 1 of the 3-step program was they covered genetic testing. So precision medicine is going to take over our world in healthcare in the next 5 years. We're going to see more change in the next 5 years than we have in the last 50. And this genetic testing will actually help people get preventive checks. So with the genetic testing, if you have the BRCA gene, for example, as a female, you have a 50% higher chance of getting breast cancer than somebody who doesn't have the BRCA gene. That will enable me as a person to, knowing that information, step up the preventive exercise that you do. So a lot of stuff going on in the genetic testing area, but they're covering the $800 test. It's a mouth swab. The person does it with their doctor at the doctor's office. So there's no conflict or PHI being shared back with the employer. The second leg of the program, or the second leg of the three-legged stool, is a blood test that identifies cancer biomarkers in the bloodstream and what organ they're attached to, so that the 52 types of cancer that there's no screening for, this blood test will give you a really good head start on if you have trouble. Let's say pancreatic cancer, which typically isn't seen until stage 3 or 4, you might be able to catch something and do preventive wellness checks for that. Or if you identify that you have a problem like that, catch it in stage 1, which is highly more curable than stage 2 or 3 or 4. And then the third leg of the stool is a center of excellence for cancer treatment. They're using the City of Hope because they are in California, but really have designed this program to hit the mark on what the employee engagement survey showed was lacking. So kudos to them for such a great program. Lack of DE&I success means employees are impacted in very direct and personal ways, contributing to both, attrition, resignation, and really maybe presenteeism, where they're not, or the new term instead of presenteeism is quiet quitting, where people just become disengaged from their groups, their employer, and their job. 38% report having a formal DE&I strategy, same as 2021. And 51% of employees who recently quit their jobs cited the lack of belonging at work was a critical reason for leaving. So something to think about when it comes to recruiting and retaining good talent. An inclusive culture is increasingly a competitive advantage for sure in organizations that are trying to retain top talent. It's also critical for employers that have unique staffing needs, right? So we have engineering clients that are looking for trained engineers, typically with experience, which are sometimes hard to come by. So 47% increased likelihood of employees staying with an organization that is inclusive, 90% increased likelihood of employees going out of their way to help colleagues if they feel like they work in an inclusive organization, 7 times increased likelihood of employees saying their organization is high performing if it's inclusive. So we're going to talk a little bit about the Bombas organization and play a quick video for you to talk about how they've incorporated social governance into their business, and successfully so.
In New York City, there is an office. In it, you'll find lots of socks, underwear, and t-shirts. This is Bombas. They make these things. They're meticulously designed, extremely comfortable, come in lots of great colors, and the most extraordinary thing about them is happening every day, all around us, and goes mostly unnoticed. Let me explain. In Muskegon, Michigan, Kim buys these. Whether she knew it or not, she just committed an act of kindness. Because when you buy Bombas, you really buy 2. 1 pair purchased equals 1 pair donated. So where's Kim's donation pair? In this van with Isaac.
How's my hair?
Isaac works in finance by day, and by night, volunteers with the Coalition for the Homeless.
It's got the name on it right there.
Every Tuesday night, he drives this van full of food, coats, and socks to those who need them all around New York City. Tonight, he gave Kim's donation pair to this gentleman. This all happened because of something that Dave and Randy, the founders of Bombas, learned back in 2013.
Turns out that socks are the #1 most requested clothing item in homeless shelters.
Why is that?
That was a great example of how a company has really not only embraced a corporate philosophy of social connection, but has incorporated into their business, making them one of the premier companies in the country that have done that type of work and incorporated that in with their business. The one thing that we all have in common is the need for connection. This reality is difficult for employers to acknowledge, build a strategy around, and respond to. But it's not. It's no longer a nice to have. It's a necessary thing to have built into the corporate philosophy, and it does affect and help the companies with their bottom line. Empathy is the key to solving the myriad challenges employers face. It's really how we address things, and it can really come across very strongly from leaders. So when we have our weekly meetings, we always take a moment to ask people how they are, how they're feeling. If we feel like somebody's struggling or something's wrong, we try to reach out. And it really is kind of teaching our managers that manage our business to take that extra step with the employees every single day and incorporate it into just a natural way of doing business. 50% of the US workforce are quiet quitters. We used to call them not present. So presenteeism, where they were there at work, but they weren't working. So quiet quitters are defined as people who do the minimum required work just to get through the day and psychologically detached from their job and pretty checked out. This is a very busy slide, I know. We're going to share the slides with you so that you can look at all of these little points and think about, how you as an employer understand what employees are thinking, so to speak. So you can take a look at each of these data points and elements that you can build into a thriving 2023 strategy. I love this slide. Jacob Morgan, the author of The Employee Experience Advantage, says, in a world where money is no longer the primary motivating factor for employees, focusing on employee experience is the most promising competitive advantage that organizations can create. I so believe that, and I really encourage everybody to shift their paradigm and really think of things differently in 2023, where we can build something where people are proud to come to work and really stand by what they do when they're on the job, so that they're proud to be there. For the first time across the board, empathy is not only expected from leaders in the workplace, but demanded. And there's a lot of pushback I see in corporations, famous stories where there's some perceived wrongdoing or something that's not fair. People are starting to push back in the workplace and saying, listen, we're not going to accept this. We really need a fair, equitable place to work and to be productive. So focusing on well-being, and now the infamous work-life balance is a starting place where where employers can really make progress initially. Creating a culture, we feel that creating a culture that makes employees feel seen and heard is a big ask. But according to the Bureau of Labor Statistics, the average turnover rate in some industries right now is 57.3%, when it was expected to be around 17%. So companies that prioritize employee and culture have significantly lower turnover rates. Patagonia, for example, a company that has been known for its clear purpose and loyalty to its employees beyond financial gain, has a 4% turnover rate. So really interesting statistics where you could build a business case for your executives to incorporate some of these strategies in there. Shifting workplace expectations, one size and benefits programs don't fit all. And we know that on the benefits side. So we have companies that are very paternalistic and want to cover everything. We have some smaller companies that are struggling financially as a business and have to have that balance where employer paid benefits is more equitable and more in front. But some of these strategies may not cost employers money. So one of the things that we've done is we have an employee engagement app. It's customizable. It's an app on your phone. And you can put a lot of strategies in addition to benefits into this communication tool. So we see employers coming up with new strategies and new ways to target some of these elements that are needed in their workplace strategies. We're going to move on to trend number 2, which is mental health and behavioral health needs. The expanding needs of today's workforce concern well beyond well-being, mental health, and behavioral health. It's well beyond just the physical well-being that we used to worry about. So prioritizing well-being and policies and benefits is critical to developing workforce resilience, and employers are seeking this. So 60% of healthcare spend will go towards improving health and well-being beyond 2040. And when we say that, what does that mean? That means we're going to shift from treating illnesses to preventing them. So our medical advancements are just so incredible. We're going to see more change, in the next 5 years than we ever have. And it's really with precision medicine and some of the understanding of our own genomics and DNA and genetics and how we respond to things and how we're predisposed for things. So we're going to see a huge shift in that. And it's also going to be shifting on the mental health side as well. 90% of annual healthcare expenditures are for people with chronic and mental health conditions. So it's, again, not a nice to have anymore. It's a need, and it's a need to focus there. The workforce continues to expect more from their employers, their employee experience, and their employers, especially as it relates to holistic well-being. When we talked at the beginning of 2022, one of the things that we said was we saw a shift in where employee benefits were focused, right? We used to have worry about physical well-being, and now we have the 4 pillars of health. And the well-being is mental well-being, financial well-being, social well-being, and physical well-being, social mental well-being. So it's interesting to see the shift in the 4 pillars versus just worried about physical well-being. Employees really want to broaden their experience. Gallup recently asked employees what they look for most in an employer. The data showed that all generations ranked employers that care about employees' well-being in their top 3 categories. For millennials and Gen Zs, their number one place was, a workplace that they want really to be connected to the organization and feel like the employer cares about them. So we're not going to cover all of this, but it's a leave behind slide because I think it's a good one. Again, it's the physical, emotional, financial, social, and development needs of what the generations, all generations are looking for from their employers. And then you can see over to the right what kinds of things employers are deploying in strategies. So paid parental leave, retirement planning, peer acknowledgement programs, and just kudos, and diverse healthcare benefits, and making sure that everybody has equitable access to healthcare, and enhanced learning programs. In the mental health area, we actually have developed modules for teaching managers how to identify employees in crisis and how to help them and get them help in a safe way. 67% of employers plan to offer enhanced employee assistance programs in 2023, and 15% plan to make behavioral health care more affordable and accessible in 2023. Well-being, also known as the whole person benefits, will continue to remain the top of employees' list And it's not the only demand that they made in 2022, but it's certainly at the top. And employers really need to address emotional well-being and health in their core programs. Employees who have thriving relationships with their immediate team members also have a higher score on the well-being than those with poor relationships. So those managers and frontline people that are managing your workforce really need to understand that and the shift and what's expected of them, and really how they can make a difference by simply starting out the meeting by going around and asking everybody how they're feeling, everything okay, and anything you want to share before you get down to business. It's 2 or 3 minutes, and it's an experience that has been working for a lot of employers in team building. These are great statistics. So 59% of the younger employees are more likely to leave if a hybrid workforce was not available to them. 11% of employees with disabilities were more likely to prefer a hybrid work model. The LGBTQ community of employees, I always say that slow to make sure I do it right, were more likely to prefer a hybrid workforce than did their heterosexual peers. Interesting statistics. 87% of people take the opportunity to work flexibly when offered. So this is a big part and a big shift in our workforce. 73% of employers plan to implement a hybrid work environment if they haven't already. The more well-being resources an employer provides, the lower their average turnover is. So certainly adding resources is key. And here are some statistics. So new research finds that employer-sponsored behavioral health care programs definitely move the needle in the right direction. So programs that are associated with improvements for depression, anxiety, fewer missed days at work, and positive financial ROI across employees' salary levels. So these programs are very valuable. 35% of employers are doing manager training to recognize and help employees in distress. And 26% of employers will offer employee peer training. So very interesting new statistics. Here are some of the types of mental health support employers are offering. So here are some of the solutions: employee assistance programs, reading materials, educational resources, trainings, additional time off for a mental health day. We periodically get a half a day on Friday off for a mental health vacation, long weekend day. Teledoc opportunities. There's been statistically in-network behavioral health providers grew by 48%. So it's a clear focus of the healthcare providers. Survey results released in August highlighted how health plans are improving access to mental health and behavioral health services. So really interesting shift here, thankfully, in the right direction, and normalizing mental health needs. So we're going to shift now into my favorite topic: changes in healthcare economics and the costs continue to rise, and why they're increasing, and what employers' strategies are in 2023. So we're going to talk a little bit about this after we share this video with you.
We have this idea in this country that when it comes to healthcare, more is better. You can't be too thin or too rich, and you can't get enough healthcare.
We all come to a similar conclusion that about 30% of U.S. healthcare spending is devoted to unnecessary services. And that's, $800 billion a year.
You don't have a significant blockage.
One person's waste is nearly always another person's income. And income turns into strong political defenses.
Why does American medicine cost so much? And if we're going to pay so much for it, why don't we get better results?
So that's a great question, right? So why do we pay so much, and our quality is out of the G12 the lowest? We're dead last in quality. So that's something that employers are really fixed on fixing with strategies. So with influences like shifting employment trends, we have deferred utilization. We've seen that significantly in 2022. Cancer has taken over as the #1 cost driver for employers as far as diagnosis. And a lot of that is due to the deferred or delayed care and preventive screenings. We see cost going up on the hospital side. So if you look at the unit cost increases that we're seeing significantly from the provider community, it's with the hospitals. They lost a ton of revenue during the pandemic when they had to shut down basic services and radiology departments and screenings where they made money. They have had a deficit. They've had employee burnout like we haven't seen in the rest of the workforce. So an extreme amount of pressure was put on our healthcare providers, nurses, and doctors in the hospitals. So the demand for higher wages is there, and work-life balance, and everything we've just talked about in the last 40 minutes. They're demanding that in the hospital settings. Rightfully so. So I think hospitals have a ton of pressure on them to meet ends. And when they go out to negotiate with the insurance companies in their contract negotiations, they're going to be increasing the per diem. So a day in the hospital in 2021 is not going to cost the same in 2023. It's going to be significantly different. The good news to employers is the contracts renewing with hospitals are staggered. So we'll see that come to fruition in the increase in cost over the next 3 to 5 years. It's not all going to hit at once. But annual healthcare spending in the U.S. has increased by 9.7% in 2020 to $4.1 trillion. Inpatient costs have increased 37%. 60% of people reported experiencing healthcare cost increase that outpaced inflation, especially with the high deductible plans. And they're signaling huge challenges in the future. 60% of healthcare costs have outpaced inflation, but the biggest chunk of healthcare cost increases for employers has been on the pharmacy side. We are actually going to be doing a webinar in March, early March. I think March 3rd was the date that we decided to do our next webinar. So we'll send an invite out. We're going to be talking about pharmacy specifically. That's all we're going to focus on, is the emerging gene therapies and the emerging oncology drugs in the specialty area, because that's the biggest piece that's influencing trend for employers. U.S. employers experienced increases of about 7%. Through plan management changes and strategic levers pulled, they got that down to about 5.6% in the last year. It's interesting to me, though, to see what's expected before plan changes and trend management efforts. It's not a huge differentiator, right? So we made a lot of employers in 2022, really for the vast majority of employers, didn't make plan design changes and absorbed the increases rather than pushing them to employees, because there was such a talent war and recruitment and retaining good talent was at such a high priority that the benefits cost shifting didn't take place as it has in the past. It'll be interesting to see what 2023 brings us in our 2024 renewals, because I think we're facing a lot of challenges, especially with the pharmacy trends. I love this slide. We do this slide every year. We just updated it for the 2023 plan year with plan information. In 2022, we didn't see big changes in healthcare cost. What we did see was absorbed by employers. And inflation really was the key driver. We talked about, a gallon of milk going up 32% from last year to this year, and eggs going up 122% in 1 year. So significant inflation that employees are feeling on everything else. And the vast majority of employers decided not to cost shift on their employees for 2022 in the 2023 renewal. I think we're going to have a bigger challenge in swallowing the increases coming just due to the changes on the pharmacy and the gene therapies, which we're going to talk about in a minute a little bit. So if you look at the why are costs rising and coming together kind of in the perfect storm here with inflation and deferred care and supply chain constraints and retention challenges in the hospitals and high drug costs. Considering that many multi-year contracts are in place, like I said, you're not going to see that change all at once, but I do believe the hospitals will go after the insurance companies for higher per diems. It's been particularly frustrating for people in my business to watch the insurance companies make extraordinary gains and financial gains in the last year. Their revenues and the stocks are significantly up in the insurance companies. They definitely won the day. And now I think the hospitals are going to come back to them and say, hey, listen, we need our piece of the pie. So typically medical inflation outpaces regular general inflation. But in 2022, medical prices were growing at similar rates to the past years, while prices on other things in the economy increased. You can see hospital care there is up 31%. No small challenge are the new prescription drugs, specialty drugs, and gene therapies that are coming to market that will be challenges for us. We anticipate frequency and severity of medical stop-loss claims. So what's driving everything in 2022 claims, when we looked with hundreds of employers, the high claimants were really driving the vast majority of trend and cost. So 49% of all large employers and 58% of those with 20,000 and above, the jumbo employers, offer some type of program to help manage the high claimants or the large cost drivers. So when you look at what's driving costs for employers, it's these four. The order might change, but it's always these four. Cancer's number one. Then you have musculoskeletal, cardiovascular, and chronic illnesses like diabetes. So when you look at those top four cost drivers, top employers, large employers are all wrapping programs around their healthcare benefits to really target those plans. And what are they doing? They're not looking at cost shifting. We just said that. And in 2022, going into 2023, most top performing employers were looking at implementing high performance networks, centers of excellence, really advanced care solutions to make primary care more readily available to their employees, telehealth, making on-care clinics available in some cases, and really, implementing pharmacy programs. A lot of employers in 2022 going into 2023, their largest focus was on pharmacy. 47% of employers are likely to use value-based plan designs, and a value-based plan design is really saying to the employee, if you do this, we'll give you that. So I'll give you an example of a value-based plan that I love is diabetics. We sit with our carrier partners every year and we look at the number of people that are enrolled in the diabetic management program, and it's really dismal. It's never good. So if you have 300 diabetics, typically you have 2 to 3% of your population participating in the disease management program. So employers are really stratifying that group of participants, right? And saying, okay, you're a diabetic. Are you adherent with your meds? Are you having ER visits? Taking the top 25% of the most unmanaged diabetics and auto-enrolling them in the disease management program. They can opt out, but they're putting them in the disease management program rather than rolling the bowling ball uphill and trying to get them to enroll. We auto-enroll people in the 401k. So a lot of employers are looking at cost and trying to control costs and saying, listen, this is a strategy that we're not able to miss the target. So lots of advocacy programs, concierge programs where we're directing people to top quality providers, navigation tools so that when somebody gets a scary diagnosis, they know where to start and they know how to find their path through our complicated healthcare system. And employers are steering employees to these top performing networks in their center of excellence to reduce cost and raise quality. We're investing in our population health management programs to enhance the clinical program models and get people to specialists that are higher quality, thus lowering the cost. So 34% of employers are using various network strategies to manage cost in 2023. And I think we're going to see even more shift in that direction in the future. 84% of employers with 500 or more employees rated enhanced healthcare benefits is important or very important to the overall strategy to improve attraction and retention of employees. So really making sure that their benefits programs wrap around their philosophy. Getting creative with plan designs and offering holistic well-being population health management programs really is going to be a great opportunity with employers to create and connect strategies for cost savings, raising quality, access to care, more equitable access to care with employees, in that sense of we care about you, right? Which we talked about in the first section of today. So we're not going to get a chance today to spend a lot of time on the prescription drugs. And like I said, we will be doing a webinar coming up on March 3rd, Friday, where we're going to just spend 50 minutes talking about the specialty drugs that are hitting the employers squarely in between the eyes, and some of the high costing gene therapies that are coming to fruition. But 50% of employers surveyed said they're taking a focused action on managing specialty drugs. The specialty drugs for oncology are the largest group coming in 2023 and 2024. And for the gene therapies, there are 50 to 100 in the pipeline ready for FDA approval by 2025. And those are all $1 million treatments. So we all saw right at the end of December that hemophiliac gene therapy was approved for $3.5 million per person. So for one treatment, it's $3.5 million. The problem with that one is some hemophiliacs, if they're a known hemophiliac on a self-insured employer's plan, they're typically lasered by the stop loss market. So very concerning problem for employers to be solving for. 87% of employers are concerned about these new $1 million gene therapies coming to market. And of course, we're going to be spending a full 55 minutes on those in a few weeks. How are employers preparing for the cost of these high cost gene therapies? Really, there are some employers that aren't really doing a lot. We're making sure when we're the consultant with a client to make sure that their stop loss programs mirror their medical programs, right? So the SPDs, what's covered under the stop loss has to mirror 100% what's covered in the medical SPD to make sure that we don't have any stop loss carriers saying we're not going to cover these gene therapies. And we are also looking at stop loss protection and the fully insured options that are on the market. So we have a plethora of products coming to market and some that are on the market to carve these gene therapies out, fully insure them for a self-insured employer, and remove them from your stop loss and your risk pool. So there's lots of things that we're going to be talking about in the next webinar. As the possibility of $1 million claims increase, and the pipeline expands for these life-saving therapies making their way through the FDA, employers must continue to weigh their responsibility to create coverage that supports employee needs. So not covering these life-curative disease therapies may be very difficult for some employers with employees. The environment of high-cost claims, utilization increases, and employment trends will keep healthcare costs higher overall. On average, 3% of the high claimants represent 50% of the total spend. So again, our high claimants are absolutely driving our healthcare costs right now. This is interesting. but the U.S. Bureau of Labor Statistics show that our workforce is aging, and a quarter of the workforce will be over 55. And these people will be driving our costs, right? So for every year that your average age is over 42, it's attributable to 3% in trend, an added 3% in trend, because we know as we age, we use more healthcare. So retiree age workers are more likely to remain on the employer-sponsored plan through that period before they hit eligibility for Medicare, and some even working beyond that due to economic difficulties. So something to think about, but 15% of American consumers with employer-sponsored insurance said they've had to defer some type of care during 2021 into 2022. So that's driving our costs. We talked about the FDA approval of the $3.5 million hemophilia treatment, now the most expensive drug/treatment in the world. We definitely are going to see more change in the next 5 years than we have in the past 50. And if we incorporate some of the new technology, like the gene understanding of genetic predisposition with the mouth swab, the genetic testing, it will definitely help us get on the right drug at the right dosage at the right time and be more effective, and thus reducing costs. We've really appreciated you participating with our webinar today. Tomorrow's workforce is looking for more than benefits. They're looking for a whole lot more. We covered a lot today. If anybody has any questions, you feel free to contact me at any time. We post stuff on my webpage all the time, helpful information, and a blog about news as it occurs. And of course, today your CE credits are listed there for SHRM and HRCI. So you can get your phone out and take a picture of those for your records. And if you can wait a couple days, we'll have a follow-up email out to everybody that attended with a copy of the slides. So thank you so much for joining our seminar today.